Good afternoon. Thank you for joining us today. We're gathered here on the territory of the signatories of Treaty 6, and I acknowledge the Métis people who share a deep connection to this land. I am joined today by my colleague David Shepherd, Alberta NDP MLA for Edmonton-City Centre, and by Patrice Koshman, who will share her story in just a minute. Danielle Smith and the UCP are failing when it comes to health care, and Albertans are suffering as a result. Far too often, these Albertans are seniors who are now needing medical care after a lifetime of service to our province. These are our parents, our grandparents. They have spent their lives caring for us, and now they rely on us to do the same for them. For the UCP, it's all about statistics and balance sheets. When they are criticized about emergency rooms that are overflowing or the lack of long-term care beds available to our aging population, their answer is to simply move beds into hallways or rent out motel rooms. We have an infrastructure deficit in our healthcare system that needs to be addressed. What the UCP have also forgotten is that patients are not numbers. They are living, breathing humans with families who deserve dignity. They're failing to address the core issue, which is that there are not enough beds available, and more importantly, there are not enough healthcare professionals to provide the care that Albertans need. Instead, Danielle Smith has consistently created further chaos in our system. While our existing hospitals are consistently running beyond capacity, and have been for years now, she decides to cancel the building of the hospital the province needs that she promised to build in South Edmonton. Instead of making recruitment and retention of doctors and other health professionals a priority, she breaks her promise of an attraction bonus and picks fights with our nurses. Instead of investing in the system we have, Danielle Smith is wasting millions creating new bureaucracies and supporting private corporate surgical clinics that only handle the most profitable, complication-free surgeries. Albertans deserve and demand better because it's about real people. Most of us will need to spend time in health facilities at some point in our lives, and we deserve to rely on them when we need them. We shouldn't have to lose our dignity just because we get ill. I'd now like to invite Patrice to share with us her ongoing experience with her father.
Thank you very much for this opportunity. Just over 3 weeks ago, my father was transported by ambulance from his home to the University of Alberta Hospital when he needed urgent treatment. My dad is an 81-year-old retired civil servant who now has complex medical needs, including dementia. He stayed in the emergency department for 2 days before being transferred to the geriatric unit. But once there, he wasn't given a room. Instead, they placed his bed in a hallway beside the nurse's station next to a computer and desk. There is constant traffic around him. The lights are obviously never turned off, and when he needed to use the washroom or take a shower, a nurse had to assist him by escorting him into another patient's room. There's no dignity in that. Because his case wasn't as acute as other patients, and he didn't require medical equipment, he wasn't a priority to be placed in a room as long as they're at capacity. And they've been at capacity ever since he was admitted. I asked a nurse why they didn't just leave my father in emergency, where he had at least some level of privacy, and I was told, that looks bad for the government. Anyone who has loved ones with early dementia knows that moves are highly distressing, so you can imagine how being left alone in a new space with constant chaos surrounding him has impacted my father. I have witnessed a significant decline in his condition since he was admitted. And then our fear was realized, and he fell as he attempted to make it to the washroom on his own. We all know that what our proud dads are like, and he didn't feel that he needed to ask for help. Thankfully, this time, nothing was broken. One of the medical staff there, who has seen this happen all too often, looked at me and said, "Well, now at least he should get a room." I was infuriated and just so frustrated with my inability to intercede for my father. I know that if the tables were turned and I was the one who needed care, that he would stop at nothing to ensure I had the best health care available. But I'm quickly finding out that the best that is available is pretty crappy. You don't realize the impacts until you find yourself in a situation like ours. My dad spent his career serving the people of Alberta, and now he's being abandoned in a bed in a hallway next to a nursing station. He is a proud man, but his dignity is being stripped from him, and there's nothing I can do to help him. It shouldn't be this way. We need to do better for our loved ones. Thank you for giving me the opportunity to share my story.
Thank you, Patrice, for sharing that story. It is truly, truly heartbreaking. I just want to note that we are also joined today by our colleague, Lori Sigurdsson, who is a MLA for Edmonton Riverview and also serves as our critic for seniors in the province of Alberta. And thank her for her work and advocacy on that. And again, thank you, Patrice. It's heartbreaking, and we all recognize how important it is that we be standing up for folks like your father. So much of the news that we get out of the legislature these days, well, it's about Danielle Smith trying to control everything, be it our post-secondary institutions, whether it's our school curriculum, our retirement pension, our police force, our municipal governments, who knows what else. I believe it's because, well, she's trying to distract us from one of this government's biggest failures, Albertans' #1 issue, our healthcare system. And, you know, it's always been our #1 issue. And we know our system is failing. It is failing folks like Patrice's father. I really wish we could say this was an isolated story, but the truth is we're getting letters, emails, phone calls every single day from Albertans with stories that are just as upsetting, from healthcare workers who are seeing this in front of them every day. Albertans need a public healthcare system they can rely on. We need enough beds in the NICU and staff to support them so that we're prepared to handle potential emergencies with infants. We need enough family doctors that our rural hospitals can keep emergency rooms operating 24/7. We need enough paramedics that when folks are in medical distress, they get attended to. They get that support within an appropriate time frame. We need a new hospital in South Edmonton to care for our booming and aging population. We need enough long-term spaces that patients aren't left waiting in hallways for weeks at a time or sent to motels down the highway for care. And to get there, we need a government who will actually prioritize the well-being and the working conditions of our frontline healthcare workers so that they want to be here, to stay here, so they can thrive here in our province. Albertans deserve a premier who truly prioritizes what Albertans care about and need, rather than her own political interests, a focus on picking fights with federal and municipal governments. Danielle Smith and the UCP sure love to pass blame to others for their shortcomings. They're trying to get us to believe that it's the healthcare system, that Albertans are asking for something too much, that the care they deserve is too expensive and out of reach. Well, my colleagues and I with the Alberta NDP, we know that this is nothing but another sleight of hand intended to bring in more privatization of healthcare and to distract us from an authoritarian, totalitarian style of governing. We know that a functioning public healthcare system is not only possible, but it's the best model for every Albertan, regardless of who they are and how much money they make, if we're willing to make it our priority. I can tell you, we will continue to work to make sure that this government does not lose sight of that. We'd be happy to take any questions.
Thank you. We'll start with questions online. And just a reminder that for those who are on Zoom, it's the raise hand function. For those on the phone, it's *9 to get into the question queue. So please state your name and outlet and who you'd like to direct your question to. So we'll start with Shaylin, please.
Question for MLA Shepherd or Metz. You spoke about workers in South Edmonton Hospital. I'm wondering what specifically do you want to see from the province to address the situation facing hospitals right now?
Well, obviously, the two biggest stresses we have that are driving these sorts of situations where someone like Patrice's father is left for days in a hallway, it comes from two things. One is a lack of proper space, and second, a lack of enough staff to be able to utilize that space to provide proper care. So we would love to see this government uncancel the South Edmonton Hospital, actually follow through on their campaign promise and get that project underway and under construction as quickly as possible so that we can have the spaces we need so that someone like Patrice's father does not have to stay in a hallway. Secondly, we would like to see this government actually prioritize supporting our frontline healthcare workers. We know healthcare workers across the system at every level of the system right now are going into negotiation with this government. We need to see this government actually show them the due respect, actually recognize the very real challenge we face with retaining the workers we have and recruiting the workers we need. So far, we haven't seen that. We've seen a government that continues to show disrespect and continues to underfund the system and fail to provide the resources those workers need.
And a follow-up?
Yeah, for either the MLAs and Patrice, if she has thoughts. The health minister said today in QP that the issue is under investigation by Alberta Health Services. I guess what questions would you want answered out of that investigation?
I'd like to know what the data is on numbers. How often are people being left in the hallway? This was something that I never saw in over 35 years working in the healthcare system. We often had patients that would be maybe sitting in a chair for a few hours near a nursing station, so they had some extra observation, but I've never heard of or seen a patient have a room assigned that's next to a nursing station. And 17 days, this is outrageous. So how often is this happening? That would be the first question. And then is this something, how long has this been going on for? What's happening here?
So I'd like to know from the government why they would consider a room with the title corridor and the room number 00H beside closets as well as staff rooms as well as a main thoroughfare for people to walk through, especially in a condition of somebody that has dementia. Why would they ever consider that a room? And as I left the hospital yesterday, they have now placed somebody else new in that position.
Second pass for questions online. Seeing none, that will conclude our press conference for today. Thank you, everyone.
Thank you.